Hi, welcome to Dr. Komal Lectures. In today's class of microbiology, we will study about COVID-19, that is coronavirus disease. We will focus on its definition, incubation period, transmission, symptoms and various stages. Also, we will study how does coronavirus harm the human body. In my previous lectures, I have discussed about virus, its properties, also coronavirus, its structure and life cycle is well explained. Today's lecture is devoted to sign and symptoms of COVID-19. COVID-19 or coronavirus disease. The symptoms are as follows: headache, nasal congestion, sore throat, dry cough or productive cough with sputum, shortness of breath, pain in muscles and joints, chills, nausea and vomiting and diarrhea. Severe symptoms include high fever, blood vomiting, pneumonia, decreased lymphocytes and kidney failure. So, what is COVID-19? COVID-19 or coronavirus is the contagious infectious disease caused by the most recently discovered novel coronavirus, which is also called as severe acute respiratory syndrome coronavirus 2. This new virus and disease were unknown before the outbreak began in Wuhan, China in December 2019. Coronavirus belong to family of viruses which are capable of causing respiratory infection in humans and other life forms. It has quickly spread globally. It is characterized as a pandemic on March 11, 2020. Now let us study about the incubation period of COVID-19. The incubation period means the time between catching the virus and beginning to have the symptoms of the disease. Most estimates of the incubation period for COVID-19 ranges from 1 to 14 days, most commonly around 5 days. Let us study about the symptoms of COVID-19. People may be sick with the virus for 1 to 14 days before developing symptoms. The most common symptoms of COVID-19 are: number 1, fever, number 2, tiredness, number 3, dry cough. Some patients may suffer from body pains, nasal congestion, runny nose, sore throat, diarrhea, nausea, vomiting and breathing difficulty. According to report of World Health Organization, the typical symptoms of COVID-19 are as follows. Most people, about 80%, recover from the disease without needing special treatment. But the people with compromised immunity or suffering from various other wasting diseases suffer a lot. We will study about the various stages. Let us study how does coronavirus harm. As we all know, a virus is a biological agent that replicates inside the cells of living organism, and it infects all life forms. Now, the coronavirus gets transmitted by aerosol droplets. After someone affected with coronavirus disease sneezes or coughs nearby, or by direct contact, when you touch a contaminated surface which is fomite and then touch your face, nose or mouth. So, aerosol droplets and direct contact. Initially, the virus infects the cells of throat, airways and lungs and starts replication, thereby turning them into coronavirus factories or industries that produce huge number of the virus which can infect further other cells. At this early stage, there is no sign and symptom of the sickness, and some may never develop any symptoms. Such cases are known as asymptomatic cases, but they are potent carriers and can infect other beings. Now, we will study about the arrival of symptoms. Once you get affected by coronavirus, after a period of 5 to 6 days, there will be some mild symptoms similar to the symptoms of flu. Coming to mild symptoms, in the initial stages, there can be body aches, fever, headache, runny nose and dry cough. Now, fever is a result of your immune system which responds to the entry and replication of the coronavirus. It marks the virus as a hostile invader and signals out that something is wrong in the body by releasing chemicals called cytokines and activates the thermostat to increase the body's temperature. It is an attempt to kill the invading organism. Now, dry cough. It is caused due to irritation of cells caused by the infection and multiplication of the invading virus. Some people might have productive cough, which means they cough up sputum. Sputum is a thick mucus containing dead lung cells killed by the virus. So, most commonly it is the dry cough, but sometimes sputum may also be expectorated. Besides these, tiredness, fever and dry cough, there may be nausea, vomiting, abdominal pain, diarrhea, muscle or joint pain. Let us now study about the severe symptom. If no medical treatment is done for the mild symptoms and thus the immunity level gets weakened, the virus replicates at an extraordinary rate and forms multiple copies and affects the alveolar sacs, inside the lungs, and there is difficulty in breathing, which is called as dyspnea, high fever, chest pain, hemoptysis, that is coughing up blood or blood vomiting, respiratory sounds which are known as respiratory crackles and respiratory insufficiency. Inflammation of the lungs occurs, which is called as pneumonia, which eventually causes shortness of breath with difficult breathing. Mostly it is bilateral pneumonia, which means it affects both the lungs. With pneumonia, air sacs may fill with fluid or pus and it becomes difficult for air to pass. People may need nebulizer or ventilator to breathe in properly. The pneumonia gets severe and the lungs are filled with the fluid, especially the alveoli or the air sacs may be filled with fluid or pus, and thus air can't travel easily, therefore there is shortness of breath. This is the outline structure of lungs with trachea, bronchi and alveoli. Right now I am making the structure of the alveolar sac. This is a healthy alveolar sac which has the open air space. We are going to study how does pneumonia affects. So, this is the open air spaces in the alveoli. This is the bronchiole through which the air pass. The above structure is the normal structure, whereas the structure I am making right now is the affected area in which the alveolar sacs, the bronchi, bronchiole all are filled with the fluid, and there is inflammation in the alveolar wall, and thus in inflamed alveoli the air exchange can't take place properly, and thus the patient has to gasp to breathe. There is bronchial swelling and decreased airflow. So, from this diagram it is clear the difference between the healthy, which has the open air sacs, and the inflamed. So, the virus entered, there were the symptoms, and now it has affected both the lungs, so called as bilateral pneumonia. So, pneumonia is inflammation of lungs. It damages cells and tissues that line air sacs in the lungs. What are air sacs? As we have seen in the previous diagram of alveoli, the air sacs are places where oxygen you breathe in is processed and delivered into the blood. Damage to the air sacs lead to the breathing difficulties. There is break off of this alveolar wall which clogs the lungs, plus there is production of the fluid, and then the walls get thickened and there is breathing difficulties. COVID-19 pneumonia. In lab tests, especially in the blood report, what are the findings? There are low lymphocytes and increased CRP. CRP is C-reactive protein which gets increased in COVID-19 patients. Also, the blood may be low in oxygen. In the CT scan of COVID-19 patients, there are patchy areas of lung damage in both the lungs, which is called as ground glass opacity. Now, ground glass opacity, GGO, it is the area of haziness, that is the opacity in lungs. So, it is the area of haziness through which vessels and bronchial structures may still be visible, whereas in the consolidation stage the bronchial structures are obscured, that means they are not visible. So, we have studied the mild symptoms, the severe symptoms, and thus now we come to the critical symptoms of COVID-19 or coronavirus disease. If pneumonia gets unchecked or uncontrolled, then it may damage the lungs to a large extent. The immune system becomes very weak and is unable to cope up, which may lead to the complications. Complications can lead to cardiac injury, injury to heart, myocarditis, arrhythmia, liver dysfunction, and septic shock may also occur. Now, acute respiratory distress syndrome is caused by widespread inflammation in the lungs, and this can cause systemic inflammatory response syndrome or sepsis. This further evolves to acute renal failure, that is kidney damage, or multiple organ failure, that means organs stop working properly or fail completely. Finally, the damage can reach fatal levels at which organs can no longer keep the body alive and eventually leads to death. So, in this lecture we have studied about the COVID-19. In the next part we will study about its spread, prevention and various FAQs regarding the COVID-19 disease. Thanks for watching. Subscribe my channel for further videos. Hit the like button and share it among your friends.